Joining us now, Dean of the Brown University School of Public Health, Dr. Ashish Jha. Dr. Jha, let's start with where the worst hotspots are, or is this sort of a rolling situation across the entire country? Where are you looking at?
Hey, good morning, Mia. Thanks for having me on. There isn't a single spot anymore in this country. Obviously, the Midwest remains probably the hardest hit, but as you pointed out, parts of Texas are really badly hit. The Northeast is starting to rise. Parts of the South are really starting to take off. This is truly a nationwide event. This is very different than the surges of the summer and the spring.
So, Dr. Jha, you've got a piece in the New York Times, an op-ed out today, where you talk about the Senate hearing that you were called to last week, assuming that they were talking to you, one of the world's leading experts on infectious diseases, about where we could go in terms of therapeutics, the status of the vaccines, and what we should be doing as a country. Instead, you had a group of senators mired in the idea of hydroxychloroquine. What did that hearing tell you about the state of mind of the people who are forming policy around this, who could actually step in and do something to slow what you've just described?
Yeah, Willie, it was a very, very odd event. And it was odd in the sense that we have some really big challenges in front of us, right? And instead of talking about those, the entire hearing focused on hydroxychloroquine. Now, hydroxychloroquine was an interesting topic in March and April. But by May or June, we'd all moved on. And the reason we moved on is that all the data came in and it doesn't work. And what it reminded me of is that we live in very different kind of information architectures or information bubbles, right? There are a small group of people who still believe that hydroxychloroquine is sort of the miracle drug, and that there's a vast conspiracy of all of America's doctors and scientists to deny the American people this drug. And that's what we need to be focused on, and that's what we need to be talking about. There are always conspiracy theories in the context of crises, but how it landed in the Senate, in the Homeland Security Committee, that to me is the baffling part. That stuff usually doesn't make it into sort of the upper chambers of our government, and there it was.
And it was such a window into why we haven't responded better, if that's where the leadership's thoughts and focus is. So there's been some hope in some of the things we've heard from the Biden administration, a few coming Biden administration. There's been hope on the vaccine front, but neither of those takes effect immediately when we need it. So you've got to wait till January 20th for a Biden administration. You've got to wait longer for most of us to get a vaccine. So what is your hope that happens between now and, say, January 20th to at least build a bridge to a new administration?
Yeah, there are a couple of things. First is that I do think the Biden team, even though they're in transition, can start doing certain things. They can start signaling to companies that there's going to be more focus on testing. They can start signaling to producers of protective equipment that there will be a market if they produce more. So there's certain types of things they can do. But the real leadership right now is going to come from, and is coming from, governors. So we saw Governor Whitmer a week ago stepping up and making a bunch of really hard decisions that were science-based because they were the right thing to do for the people of Michigan.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.